It's important to understand right now that this is a process that's just a few weeks old since the vaccines have been approved and are now being out in the marketplace. Each state is getting an allocation of vaccine and then subbing it out to the various local governments, primarily through the local hospitals, into the various jurisdictions. So Westchester County Medical Center, which has been identified as the hub medical facility in this region, is the one that has been tasked with looking at distribution across the 7-county area. Those of us as county executives have been tasked with being involved in that process, being helpful, and trying to help manage and coordinate that process. So Ken Jenkins, Deputy County Executive, myself, Joan McDonald, our Director of Operations, the rest of our team are now working with the Westchester Medical Center along those lines. The county government itself has received 500 vaccines, Moderna vaccines, from the state this week, and we have been tasked with making sure that people within the county government who fall into the key priority categories have been vaccinated. That would be all of the nurses that work for Westchester County in the Public Health Department, direct contact with patients, also the medical doctors that work for the County Health Department, those that work in the Department of Social Services that are nurses that have interaction with the client base of DSS, and also some of our county staff people who work in the Labs and Research Department. And the Labs and Research Department for the county includes our coroner function, so that autopsies, things of that nature are part of what that department does, also handling certain kinds of chemicals, testing and so forth, and each of those individuals are also potentially exposed to the virus, so they too are part of the group that will have the vaccines administered to them. We will inoculate that full cohort of individuals, all of which fall into the current phase of inoculations, and whatever vaccine is left after that will go to other individuals that fall into that original cohort. The 1A phase group is the one that's being vaccinated now, and again that represents doctors, nurses, respiratory technicians, people who are in patient contact in public health settings. It also includes nursing homes and nursing home staff, and that line of vaccines are going through a couple of the major pharmaceutical chains, CVS, Walgreens, and so forth. They are obtaining the product vaccine and making sure they're administered in the nursing homes in and around our area, and then also EMS workers, and that is also part of this situation.